I'm going to change my estrogen patch and apply my testosterone on camera, because if I had seen this on my feed 10 years ago, probably would have changed my life 10 years ago instead of in this past year. So I just want to make everybody a little more familiar with hormone replacement therapy and hopefully get you a little more comfortable with seeing it, what to expect, just, what it is. Here is my patch that I'm taking off from last week. This is the patch I'm going to be putting on. Looks like that. Has a little split in the middle, and I'm going to put it on the opposite side. Peel off one of the little plastic things, stick it on there. Pull it off, and it is on, and I don't have to think about it again until 3.5 days from now. All right, so this is what I use for testosterone. It is a compounded cream. This is actually a 3-month supply, and my dose currently is 4.5 milligrams. So I do 3 clicks of this little thing here, turns, 2, 3, and it comes out the top. And then I just give it a little push on the bottom. And I take that. It's got a little silicone tip here that's tapered. I use that to rub it in, so I never even touch it with my fingers. Take it, put it on the inside of my thigh, and I rub that in good till it disappears, basically. Okay, so that's rubbed in good. Just let it kind of air dry. Put the cap back on. Don't have to worry about transferring the testosterone to any children or pets or anything like that. I'm good to go. Put testosterone on daily. Change my patches once every 3.5 days. And I literally do 3.5 days. So I do Wednesday mornings and Saturday nights. So every 3.5 days. And if you're my age, the window for you to get the most benefit out of hormone replacement therapy is slowly closing. I'm 60. I started when I was 59. It's best to start before age 60 or within 10 years of menopause. I started menopause when I was 54, so I fell in the window, luckily, to get the most benefit. Now, that's not saying that you can't start hormone replacement therapy later. What it's saying is, in order to get the most benefit out of hormone replacement therapy, and that's your bone benefits, your muscle benefits, your cardiovascular benefits, hormone therapy keeps healthy cells healthy. So you want to catch those cells while they're still healthy. That's the idea behind doing hormone replacement therapy at the earliest time. That's the idea behind starting hormone replacement therapy when you're in perimenopause. That's the idea, is to catch those healthy cells while they're still healthy and keep them healthy, because sometimes things can't be reversed. Luckily, muscle loss and bone loss can be reversed with the right therapies, with the right exercises and the right nutrition. You can reverse some of those things. Not everything can be reversed. So we want to start early enough to get the most benefit. That's the idea behind starting early. Hormone replacement therapy. It's nothing to be afraid of.